This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenny Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
Hey everyone, welcome to another episode of the Dr. Jess Show. I'm your host, Dr. Jess, and today we're diving into a fascinating and important topic: how deficiencies in certain nutrients can actually increase the risk of depression and other mental health disorders. We've got a special guest on with us who is a specialist in nutrition and functional medicine, Jenny Berman. Welcome, Jenny.
Thank you. Thanks for having me.
Yeah, we're so excited to have you on and pick your brains because we know that you've recently written a book and you are a functional medicine specialist. And basically, you've written a book about how to heal your gut from the inside out. And it's the Berman method is basically what you talk about in the book, where you help treat problems and not symptoms, which deeply aligns with what our practice at Arantia is about, treating the root cause and not just covering up symptoms. So we're stoked to hear more about your book and whether basically you share about autoimmune diseases, inflammation, weight management, weight loss, from sleep disruption and blood sugar instability. You work with people one-on-one and really help treat folks who really want to live their highest, best quality of life and feel happy and more healthy. So I'd love to welcome you again onto the podcast and hear from you about what your inspiration was when writing this book.
Absolutely. Yes. Thank you for having me. And I love that the practices align so much with treating problems and not symptoms. And that's really what stimulated the writing of the book was my own health concerns that I had gone through bouncing from doctor to doctor in Western medicine. I went through physician assistant school and was trained as a Western medicine provider. So that's what I knew. And I was trying to help myself, bouncing from doctor to doctor, not getting the answers that I wanted, and really having to do even deeper research and touching into the more functional and alternative medicine world. And that's where I decided, I instead of going on this 3-year journey and making everybody else go on their 3-year journey to figure out their own health, we need more answers. We need something that is written to the general population, that the general population can understand and start to implement some changes for their own health to getting answers. Majority of books out there are written for medical providers, for doctors and on their level, but we need something more basic and general that we can understand and implement on our own. So that's what really drove me to writing the Berman method to heal your gut.
I love that. Now, can this book really be for everyone and anyone, or is it for a more specific person who's looking to achieve specific things? Is there anybody that this book would exclude?
Absolutely not. We talk about all sorts of things in this book between gut health, as you've already mentioned, blood sugar stability to help with those who have prediabetes or type 2 diabetes. But we also talk about energy, hormone balance, sleep issues, dehydration effects. So it really covers all aspects of our lifestyle and the day to day that we're living. Every person that reads this, and if they read it and they actually open it, can take away one pearl to make their life better.
I love that. That really resonates with me, especially because a lot of our folks, are ask us often, what types of things should I eat to help, maintain a balanced diet, to help also maintain physical health and well-being. But a lot of our folks, often say that certain things that they eat make them feel worse. Of course, the ingredients can do that if they're not looking carefully at, what they're consuming on a day-to-day. A lot of folks here are on the go, coming in between work hours, and they'll admit, I DoorDash things, or I get off schedule with the meal prep. So we're going to also kind of pick your brain on how not having a balanced diet can affect your mental health and overall well-being, and what things that folks can start to incorporate to improve their nutrition and overall sort of energy and uplift them mentally.
For sure, for sure. Diet has so much impact on mental health. And the thing that we see from a lot of clients, especially with how busy they are and bouncing, is that they're just skipping meals and not eating, or they, want to lose weight. And so they think, oh, if I just don't eat, that I'll lose weight. And certainly those things have a big impact on mental health as well.
Absolutely. Now, with your method, the Berman method, can you just give us an overview of the method and how it differs from the other approaches that might be out there, maybe the other ones that are written more toward the medical professionals, and how somebody could start to implement it?
Absolutely. So, with the Berman method, as you already mentioned, we're treating problems and not just symptoms. So, if an individual comes into our office because of weight gain or fatigue, or they're not sleeping through the night, or they actually were diagnosed with irritable bowel syndrome, Crohn's disease, we're not treating the symptom. We're not giving them a pill and saying, okay, here, go take this and your sleep is going to be better, or take this and your diarrhea is going to be better. We're actually coming down to what is happening internally that's causing the problem. And within the book, we give these basic recommendations of starting to identify your own triggers, your own problems. Now, certainly there can be things that will be done on a more extensive basis as far as getting blood testing and seeing a professional to help you get to the next step. But there's definitely basics that we can do from home as far as identifying what foods are causing a trigger. Are we not eating frequently enough? Is our blood sugar unstable? And just starting to recognize the symptoms of these problems will help you to figure out, okay, which problem am I having, or am I having multiple?
Yeah, absolutely. It always seems like there's, one thing that connects to another thing and another thing, and that can be a little overwhelming for people. And I think that's even more why we're having you on, because we want to be able to have that specialist that people can go to and really help them peel away the layers and figure out, okay, what is this sort of main driver, and what is the first thing that we need to tackle, because it can be very overwhelming, and then sometimes people end up not doing anything and they get stuck in indecision of I don't know what to do first, or is this going to be the best route to take.
Right. That's absolutely true. And that's part of within our practice where we treat clients one on one. We are seeing our clients initially on a weekly basis to help with that guidance and to take away that sense of overwhelm with the amount of, identifying factors that we've come up with. There might be four different things playing into each other, but we're going to take it one step at a time to making the changes to helping you feel better and see the changes on a weekly basis, but then being able to guide, okay, what is the next step this week? What's the next goal for this week to make it less stressful? And I want to bring this back to what you mentioned with the mental health is it absolutely is impacted by several factors. And unfortunately, with Western medicine, we're going straight to using medications to help with anxiety, depression, sleep disorders, insomnia, rather than identifying the cause between the gut, the blood sugar, the stress response that's happening internally. So, as you mentioned, there could be several factors playing into it, but we really need to take one step at a time. And that's what I try to break down in the book, but then also offer through our one on one care with our clients.
So it really is sort of a whole body, whole mind, holistic method, it sounds like.
100%.
And so your book really stresses and emphasizes the importance of listening to your gut. I love that expression. I feel like I use that often too. Can you elaborate on what this means in practical terms and how your readers can start implementing it in their daily lives?
Definitely. So we hear listen to your gut, and it's like, okay, what is my gut instinct telling me? Which certainly we should take into consideration. But we take it one step further and say that the gut is the second brain. So if your gut is not healthy, your body systemically, inside and out, head to toe, will not be healthy. Over 90% of our dopamine, which is our upper happy hormone, is created in the gut. Over 75% of the immune system starts in the gut. So if our gut is not healthy as far as the gut lining and the biome, meaning the environment of the gut, the good bacteria versus bad bacteria, then we're not going to have a healthy immune system or mind. Our hormones of the brain are going to be imbalanced, leading to these mental health disorders. Our thyroid won't be healthy. We're going to have more fatigue. We're going to have more inflammation of our joints, more chronic joint pain or muscle issues, tendon issues. In your world, a lot of pelvic floor disorders are definitely associated with gut health. So we really have to start at the gut and say, okay, what is causing the inflammation here? Is it a food that we're eating that's causing inflammation? Is it our stress hormone called cortisol that is breaking down the gut lining? And cortisol can be high. From that stress hormone could be high from external factors, so work, husband, wife, kids, finances, but it also can be elevated due to internal factors such as medications that we've been put on, foods that we're eating that are causing inflammation, or other hormone imbalances. So we have to start there with first trying to eliminate or reduce the inflammatory foods that are in our system. So, most commonly, these are going to be foods like gluten products, dairy products, almond, occasionally in other individuals, soy and egg, yeast definitely can be impactful. So, we have to start there by identifying what foods are actually causing inflammation in your body. May not be the same food for everybody. And that can be determined based off of trial and error, or it can be done through a blood testing and really figure out black and white what foods are causing the problem. Then we take it, and I'll make kind of summarize this shortly, and you can definitely read through it in the book. But then we take the next step of looking at other factors that are affecting our gut health, like our blood sugar and that stress hormone that I've already mentioned.
Yeah, absolutely. Just to trace back to what you were mentioning in terms of the connection for the gut and the brain, we do see that often here with pelvic issues, but their vagus nerve, their parasympathetic nervous system is not really regulating well. Everything is kind of on overdrive when we start to see folks initially. Their autonomic nervous system is really not regulated. So whether they have digestive problems or not, sometimes that can affect the pelvic organs and their reproductive health. Even sometimes folks have, their hormone levels are off and their cycle becomes off as well. They can develop pelvic pain. And I think, to touch on what you just highlighted, a lot of folks just don't know what the instigator or the trigger is that they are eating. Maybe they think, for example, just because they're not intolerant to gluten, that all the gluten they eat is fine for their system. But maybe there's a tipping point that they need to learn, and what is a safe amount and what is really creating the problems and the inflammation.
Most definitely. And that's something that we talk about with clients on a daily basis, whether they have food sensitivities known or not, is that we really should be rotating all the foods that we're eating in our diet. We don't want to consume the same foods every single day for weeks at a time, because our body, the histamine level, the allergy level starts to build when we're introducing the same type of antibodies, the same type of immune response to the body. So in general, one simple tip that we could take away is that our foods in our body need to come in rotation. So every 2 to 3 days, we're having that type of food, not on a daily basis.
Oh, that's interesting. For those people who like routine and like to do the same thing, we have a bunch of those types of patients who are very structured and they say the same thing every day. And, it's what I like. Especially children, I think, too, can get stuck on the same types of foods that they like. What, in your experience, are some common misconceptions about gut health that you highlight in your book? And how can the readers and listeners avoid falling into these traps?
Absolutely. So, probably the biggest one that I hear is, for my gut to be healthy, I have to go on a plant based diet, or I have to go on a
Mm,
keto diet. Those are
hmm
two of the most common, and absolutely not the case. We certainly see plant based clients in our office, but we are a big protein focused clinic. And again, it doesn't have to be animal based protein, but to heal your gut, you do not have to eat plant based. You can absolutely have animal containing products. We just need to make sure it's the right type of animal containing products. So that's one of the biggest. And then the other thing is that healing my gut has to be very boring and limited. And again,
mm,
that's not the case at all, as we need to have, as I've already mentioned, the variety. And this really needs to be a lifestyle. If we're going to heal our gut, we have to create a lifestyle for it of something that we can do and maintain long term. So, working with our clients through this process is saying, okay, this is where we're starting for the first 8 weeks. Then this is where we're going for the next 8 weeks. And this is how we're transitioning you back to eating a very normal meal plan with wide variety that isn't plant-based or isn't keto diet, not so limiting.
That's really interesting too about the variety that you were saying prior about every kind of change it up every few days because your body can only take so much of the same thing. For the meat proteins that you were mentioning, is it mainly, like grass-fed meat that you guys recommend?
Yes, if our clients can handle or afford doing grass-fed organic proteins, that is absolutely what we recommend. Although, again, that may not always be maintainable for certain individuals. So we really just try to go with the leaner options, getting as lean of protein as you can, rotate between your chicken, ground turkey, fish, beef if you have it, venison, bison. All of these proteins are okay to use as long as you're trying to go for the leanest option. Absolutely, if you could do organic or grass fed, that would be the best case scenario. But if you don't, just really try to keep it limited for the ones that are higher in fats.
And is there anything in your book that discusses the benefits of intermittent fasting and how that can kind of improve gut health?
There is a chapter in there about intermittent fasting, and intermittent fasting certainly is controversial. Really depends on the individual. The main factor playing into intermittent fasting to determine if it's a good idea or bad idea for you as an individual is your blood sugar level. If our blood sugar is more unstable, so we have that history of pre-diabetes, or some call it insulin resistance, type 2 diabetes, intermittent fasting may not be the right thing, just because that 16-hour period of not eating with intermittent fasting is really too long for the body to stabilize its blood sugar on its own. So it can actually increase inflammation for some people. Versus if you have a very stable blood sugar and no signs of insulin resistance, that may be beneficial to regulate inflammation. So that's a very controversial, individualized type of recommendation for meal planning and timing of eating. Most generally, for the types of clients we see, just age wise, right? They're my client basis typically are in the 60 above range, although we've more recently been doing a lot of work with the women in their 30s with fertility issues. But for majority of our clients, they have a sense of insulin resistance, and so we're typically recommending more frequent eating and meals with the lean proteins and more vegetables, more fiber in their diet.
I'd love to pick your brain a little bit about our type of postpartum patient that we see commonly, and especially in the fourth trimester, where, there's still significant hormonal fluctuations that I'm sure affect our gut motility and, also just changes in estrogen and progesterone levels that can affect the gut brain axis. Is there something that you recommend that a postpartum woman have as a staple in their diet every day? And I'm sure maybe the intermittent fasting wouldn't be the best for this group of folks, because I know, for just speaking firsthand, I get lightheaded from pumping and all of that, and I always snack throughout the day. And if I don't, I get in trouble. So
Yeah. Yep. That's absolutely right. Postpartum is, definitely a time where I would recommend that we are focusing on more caloric density, especially if they are pumping and nursing, to provide the energy to their body, but also to the milk that they're feeding their baby with. And particularly in this case, healthy fats are extremely important. And that's something that we have a bad sense about, just with years and years of people saying, oh, don't eat fat, don't eat fat. But that's actually not accurate. Fat is not what's causing majority of our problems as far as obesity and heart disease, even though that was the thought many years ago. So for the postpartum women, we are really focused on getting unsaturated fat, so healthy fats through their diet, making sure they're having an adequate amount of healthy fats for their macronutrient balance, meaning proteins, carbs, and fats, then the next thing we focus on is their protein intake. And again, like you've already mentioned, if we're not eating, then that's where our body is really struggling because of the amount of energy we're providing to the milk and to the baby that we're feeding. So, getting up in the morning, drinking 16 ounces of room temperature water to stimulate the metabolism in our brain. And then from there, we're getting a lean source of protein with a healthy fat every 3 hours. I mean, think about as often as your baby's eating. Your baby's eating every 2 to 3 hours, right? That means our body needs to be producing that amount of energy as well.
Absolutely. I know just if you're a breastfeeding mom or pumping mom, something like 30% of your energy stores just from that throughout their day, which is a lot. And then you add in your work and maybe workout and all of the above.
Well,
So,
yeah, and just the daily living activities that our organs have to work, right?
right.
Our body is still working on top of giving 30%. So if you're giving 30% to your baby, then that 70% left you have to fuel, plus your organs have to function. So that's another 30%. That leaves 40% for us to then finish all the other activities that we want to do in a day. So it's certainly taxing.
I'd love to, hear about some of your success stories. Maybe if you could share, a success story from somebody who applied the Berman method and saw significant improvements in their health, and what did that look like, and maybe how long did that take, just to give people an idea.
Absolutely. And of course the length time is always
It
a
varies.
difficult question to
Yeah.
answer. Yeah, we'll kind of walk through that. But for your sense of population, we've certainly had more success with our fertility and infertility patients. And that's something that I was drawn to after my own history of having a lot of fertility concerns and taking, about 4 years plus some miscarriages to be able to have my first baby and going through all sorts of medications to get there, and finally ended up having several successful pregnancies without any medications or IVF. So that was all stemming from gut healing. And now we've really implemented that into our own clientele with fertility or infertility issues, really is what we call it. So just starting at their gut health and identifying where is this hormonal imbalance occurring? Why are we not able to have a menstrual cycle or to conceive appropriately or to carry a healthy fetus? But then outside of that, I've had one client specifically that I thought of when you first mentioned this is he came to me for weight loss. And when he came in, he had already had a diagnosis of some pretty big words, I'm going to say, which no summarizes the fact that he had a lot of inflammation. But he had rheumatoid arthritis, ulcerative colitis, and ankylosing spondylitis. So
Mm,
just a
triple win.
triad of inflammation, right? So he came into me on opioids and on steroids. I mean, chronic. He would take them every single day, but came in for weight loss. And so we started talking and saying, your body is not going to lose weight easily if we don't get your inflammation under control. And so, long story short, through doing his food sensitivities and gut healing protocol, he actually not only lost over 35 pounds, but also was able to completely come off of his opioids and steroids because the amount of improvements he had in just generalized inflammation and pain. So, obviously he was very surprised coming in for weight loss that we actually helped with his chronic conditions that he had as well. Time wise, I talk with clients all the time about this as far as gut health is we can start seeing improvements within a month of starting the gut healing process, but the whole gut healing process is really kind of indefinite. It's something that we're always working at and implementing for a lifestyle, but it's more the fact of, okay, we're seeing this turnaround within 6 weeks, 8 weeks, 12 weeks, depending on the patient's history and how much they've been through.
Wow, that's a awesome success story, actually. I'm sure you have so many more. Do you ever have people that you work with that the success of the method can be deterred by, like a partner or somebody they live with? The support system is not there.
That's very challenging, of course. When they feel like they can't implement the changes to their meal plan because they have to cater to their spouse or to their children. But that's what we specialize in. That's why we are here to help guide you on, okay, how can we cook one meal for the whole family that's going to focus on what you need, but also cater to their likings. And why we see our patients so frequently on a weekly basis is so that we can be the ones to provide that support system, that guidance, that knowledge base of, okay, this is where we want you to go from here. What is going to be your next goal? How can you confide in us to help get you through this difficult situation that you may not be able to speak with your spouse or home partner with? So, we really work to help guide the clients through those hardships that they may have without a lot of support at home and really make it a simpler lifestyle for them to maintain at home as well.
Yeah, I think that is huge to make it not something that you dread to do, but something that's simple and easy and that you can build into your routine, especially if like our patients here have kids and they're in that phase where they're younger and there's just a lot to do so that it doesn't just become a dread, but it's easy to incorporate.
Most definitely. And that, comes from either finding things that the kids will eat in addition to you, or maybe finding some easier prepped items that you can go to that aren't, fast food, but something a little bit simpler that you can pull out of the refrigerator or the freezer while you're in this stage of life that you can't particularly go for Whole Foods all of the time.
Yeah, absolutely. So, for everyone that's listening, in case you didn't catch it in the intro, Jenny is also a certified fertility specialist, amongst being a certified nutrition specialist and personal trainer. We certainly have a population of folks here that come to see us for fertility and all sorts of pelvic floor things that they want to work on in the hopes of conceiving. And so, really, if anybody is listening and struggling, whether you're local to Rhode Island or not, you should get in touch with Jenny. I'm sure that it would be very beneficial if you're struggling with fertility, because there is this whole other aspect of nutrition and gut health that is a main factor as to why it could be taking a little bit longer to conceive and to not address gut health in general is I think a big missing factor and missing link into healing and feeling your best. So I want to thank you, Jenny, so much for joining us on the podcast. Tell us how people can connect with you, how they can find you, where they can get your book.
Absolutely. So, The Berman Method, Listening to Your Gut is the name of the book, and it is available on Amazon. You can also find us at www.berman, BERMAN, PT, like physical therapy.com/wellness. So bermanpt.com/wellness. And you can also find us on Instagram, and it's Berman_wellness on Instagram. So definitely reach out to us, get in touch with us. My personal email, Jenny, JENNI, @bermanwellness.com. So we would be happy to touch base with you. We certainly have clients that are virtual that we work with through our health coaching and functional medicine practice.
Excellent. Any upcoming books or things that we should be looking out for?
I'm starting the process of book number 2, really focused on autoimmune disease and infertility. So
Oh,
that
I
could
love
be
that.
definitely a good one for your client basis. And we'll be happy to share it once we get that process completed. More immediately, we are launching an app this summer. So that's really where our focus
Oh,
is right now.
exciting.
Yes.
All right, keep us posted on that.
Well, thank you. I appreciate you having me on, and hopefully, this has helped at least one person.
I know it has. And we'll be sharing this out and we look forward to having you on again. Thanks, Jenny.
Thank you.
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenny Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platforms. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.